Hi, a very good evening, all of you. So how are you guys doing today? So today's live session will focus on few select topics from general medicine. I hope you guys are all ready. We'll start with yesterday's case-based question, and then we'll move on to the topics relevant to some specific points or some specific areas in general medicine. I hope you guys are all doing fine. By the way, so how are you guys doing? How are you all doing? Option A, good. Option B, very good. Option C, very, very good. Option D, awesome. So which option would you choose? Yeah, hi. Hi, everyone. A very good evening. So I think I started this session 5 minutes prior to the scheduled time, 8:15. So in the meantime, let's have some general discussion. I'll start with my presentation, and I have something to share. So who is man's best friend? Don't say woman. By the way, who is woman's best friend? Or for that matter, who is human's best friend? It's lovely dogs, isn't it? So always having animals in our vicinity, especially dogs, gives us bouts and bouts of positivity. I mean, you should experience the same. If you're not in touch with any dogs, I would definitely suggest you all to experience this relation. So when I was during my childhood, we used to have another dog. I don't know whether it's Lhasa Apso or Shih Tzu, but we named it Jimmy. So after it died, it was very devastating. It's like we lost like a family member. So pet dogs are like our family members. So once they leave, right, it'll be very devastating. But that will be a sweet memory. The relations, the memories which we had, the experiences which you have with your pet dog will be everlasting, even though the dog is not there, right with you. The same applies to everyone, any life form, isn't it? Any life form for that matter. So I'm sure some of you guys might be having some pets. So I'm sure you're taking due care of that, just like how I'm taking care in this particular image. Okay, right. So by the way, it's Toffee, and her name is Toffee, and she is a Lhasa Apso, the name of the breed, and it's a Tibetan breed. Usually, if you Google the pictures of Lhasa Apsos, they have very long and curly hair. Because of difficulty in maintenance and because of the climatic situations here, we decided to keep her hair short. Okay, so it's one of my favorite pics which I wanted to share with you. So let's move on to today's presentation. So case-based question. So Anku and Tenku visited their family physician with a chief complaint of headache. After taking history, the physician prescribed medication and has written TID on prescription, which is an abbreviation for which are the following options would you choose? Okay, it seems most of you have chosen option D for the previous question. So it's wonderful to know that you're doing awesome. And remember, only one option is the right answer, that is option D. I'm talking about the previous question. How are you doing to that particular question? So option D is right answer, without any doubt, without any confusion. No mixture. Don't mix all options. Okay, well done. So which of the options would you choose? Really? After meals? TID, does it mean after meals? Okay. First of all, we have these Latin names, BID, TID, QS, and so on and so forth. So I will review some of them in detail. Like, as I said, these are Latinized words derived from Latin. BID means bis in die. TID, ter in die. So BID, bis in die is twice daily, twice a day, whereas TID is thrice daily or 3 times a day. Similarly, we have Q12H, that is every 12 hours, Q4H every 4 hours. Stat, this I think, I'm sure you'll answer it accurately. What does stat mean? When I come across this word in Hollywood movies, Bollywood movies, different movies, web series, whatnot. Stat, they say stat. The stat, as you know, it is in very fast or immediately, stat immediately. And HS, small letters, HS is bedtime. PRN is as needed. AC, before meals. PC, after meals. So before meals, you want AC. So AC before meals. And after you have some meals, you want to play on a personal computer, PC. So after meals, and then SIG, that is label. SIG means label. And I still remember during my second year BDS final exam, the pharmacology final exam, one of the internals, one of our professors who was an internal way back then, asked me a bottle which contains some liquid. And it's a common liquid which we use in pharmacology. And alongside that liquid, it's written as QS, small letters Q, small letter S, QS. Yes. So then he asked me, what does this QS stand for? I had no idea. I had no idea and I couldn't answer. And he was so good that without scolding me, he gave me the answer. And he said QS stands for quantum sufficient or quantum satis, in Latin. So which means pour as much as you want, as much as needed for that particular formulation. So QS, quantum sufficient or quantum satis, quantum sufficient. So the reason why I wanted to share this is I had two experiences and two wonderful memories based on this experience. One is every moment is a learning experience, as I keep on telling you. Even the day of exam, it's not that we're just being tested and we have to vomit something on the day of exam just for sake of marks or grades or for appreciation. Rather, even the day of exam is very important for learning. For that matter, each and every moment is very important. So I had learned something on that particular practical day, and I still remember it till date. And I'm sure and I'm confident that I'm going to take it to the grave without any doubt. So every moment is a learning experience. So one thing which I learned. And second thing is there are some teachers, unfortunately, or professors, very some, who really scold students, criticize them. It's okay to criticize, but they look down and then they talk all nonsense if they fail to answer. So it's a very difficult experience. Having such experiences is very unfortunate and difficult to digest. At the same time, this lovely professor, pharmacology professor, he was so lovely that he actually told us the answer. And he said the actual function or the relevance of that particular short word or keyword. So there are some people who actually want students to learn. And also I've come across several professors or teachers who asked us to refer particular literature, find out and get back so that their intention. There are some wonderful teachers whose intention is to make their students learn. So if you come across such teachers, I mean, I personally consider it a very fortunate experience to have those kind of teachers who actually want the students to learn rather than harassing them in the name of Viva, in the name of other nonsensical things. By the way, I think I'm deviating, but so I just wanted to share those two experiences or two wonderful insights which I received based on that particular experience. So SIG, SIG is label, L-A-B-E-L, label, right? So several keywords which we discussed, and I hope it's clear. Okay? Yeah. Now, let's move on to the next question or the topic proper, where we will discuss select topics from general medicine. By the way, there is no right answer in this particular question. I think that's obvious to you by now. So first question, there is increased parathyroid hormone secretion to compensate for prolonged hypocalcemia. In which of the following condition, primary, secondary, tertiary, or quaternary hyperparathyroidism, which one do you think is right answer? So it clearly states that the PTH glands, parathyroid glands are secreting parathyroid hormone to compensate for prolonged hypocalcemia. So what do you call this condition? So in the meantime, let's review some information. So I'll get back to that table a bit later. So there are three types of hyperparathyroidism. So ignore that fourth part, just to fill in the options. So primary, secondary, and tertiary hyperparathyroidism. So primary hyperparathyroidism is an autonomous secretion because there is some tumor. So autonomous secretion of parathyroid hormone, usually by a single parathyroid adenoma. Whereas secondary hyperparathyroidism, so this secondary hyperparathyroidism is increased PTH secretion to compensate for prolonged hypocalcemia, thus increasing serum calcium levels by bone resorption, and this is associated with hyperplasia of all parathyroid tissues. In fact, my mother has secondary hyperthyroidism. Levels have elevated 3 to 4 times to that of normal because of hypocalcemia, and to compensate for that hypocalcemia, her PTH levels are shooting up the roof. Tertiary hyperparathyroidism, continuous stimulation of parathyroids, as in case of secondary hyperparathyroidism, occasionally results in adenoma formation and again autonomous secretion of PTH. So that's tertiary hyperparathyroidism. Now let's look into this particular table from Davidson and some important points relevant to that. So primary hyperparathyroidism, you can see several causes of a single adenoma is most common, 90% around. Serum calcium is raised, PTH is not suppressed. Secondary, because of chronic renal failure, malabsorption, osteomalacia, rickets, serum calcium is low because body is trying to compensate for this low calcium levels, low serum calcium levels. PTH is raised 3 times, 4 times, 5 times, or even 10 times to that of normal, 2 to 9 times to that of a normal. Tertiary is similar to that of primary because tertiary is nothing but almost primary, isn't it? So I think it's clear. And even if you have no idea, you can see compensation mechanisms happens as a secondary means. So you can remember that way. So it's up to you how you remember. So as most of you have chosen option B, fantastic. I think almost all of you have chosen option B. Secondary hyperparathyroidism is the right answer. Even if you're wrong, you have nothing to worry about. As I said, every moment is a learning experience, even the day of exam. Take my word. Now let's move on to the next question. A patient has long-standing history of GERD, gastroesophageal reflux disease, and is suffering from severe dysphagia and chest pain. On investigations, that is chest X-ray, barium swallow, and all, it was observed that intrathoracic hiatus hernia twisted upon itself. What might be the condition? You can see the illustration in the right part of the screen. So what could this be? Benign esophageal stricture, Barrett's esophagus, gastric volvulus, or high-grade dysplasia. So which one do you think is more appropriate answer? So there are several complications of, keep answering. There are several complications of GERD, including all the options like esophagitis, Barrett's esophagus, columnar lined esophagus, iron deficiency anemia, benign esophageal stricture, and gastric volvulus. So the following are the complications which are associated with GERD. So Barrett's esophagus is a pre-malignant condition in which squamous lining of lower esophagus is replaced by columnar mucosa with areas of metaplasia, which we discussed in general path section of e-classes and also in previous sessions, if you remember. Gastric volvulus is occasionally a massive intrathoracic hiatus hernia twists upon itself, which is gastric volvulus, causing complete obstruction, severe chest pain, vomiting, and dysphagia. The diagnosis is made by chest X-ray and barium swallow for contrast, and most resolve spontaneously, but then recur, and so elective preventive surgery is usually advised. By the way, you can see hiatal hernia here. You can see some part of stomach protruding into the chest cavity through diaphragm. So that's hiatal hernia. So hiatal hernia is the upper part of stomach bulging through diaphragm into chest cavity, right? So I hope the answer is clear by now. Option C, gastric volvulus is the right answer. Actually, I wanted to place the chest X-ray image, but anyways, I think I missed it out. So chest X-ray with barium swallow also will. Of course, that's how we diagnose this particular situation, gastric volvulus. Okay, so you can look into the symptoms: severe dysphagia and chest pain. So those are some hints which you receive. Investigations: chest X-ray with barium swallow. There will be intrathoracic hiatus hernia. So just the upper part of stomach protrudes into chest cavity through a diaphragm, right? Gastric volvulus is right answer. I hope it's clear. Well done. Now let's move on to the next question. RNA defective virus that has no independent existence. So it's a dirty virus. So which one of the following options would you choose? Hepatitis A, B, C, and D. So the hint is already given in the form of equation. As they say, when a patient comes to you with a chief complaint, it's actually not just chief complaint, but the patient is giving you the diagnosis. Just likewise. So this is not just equation. In fact, it has hint in itself if you carefully observe, if you are quite observant. So guys, I'm really sorry. It's an emergency. It's an emergency related to my mother's health. I'll get back to you in 2 to 3 minutes. Okay, I'm really, really sorry, please. Yeah, I'll just pause this session. Just give me 2 to 3 minutes. Thank you so much, and I really apologize. In fact, I had to go to my nephrologist today, my mother's nephrologist. Her hemoglobin levels dropped to 4.4, and he advised some iron injections and repoitin, human erythropoietin, 10,000 international units. So we're trying to give her the same. So she is not at all feeling well. So it was a call related to that. So I'm once again really sorry. So we'll get back to our discussion. Right. So RNA defective virus that has no independent existence is which of the following? Hepatitis A, hepatitis B, hepatitis C, hepatitis D. So which one do you think is more appropriate answer? Yes. I think it is streaming fine, right? Yeah. Okay. So which one do you think is more appropriate answer? As I've mentioned previously, it's a dirty virus. So remember that way because it has defective virus, dirty virus, hepatitis D, delta virus. So let's review some information regarding the same. Hepatitis D, delta virus. This is RNA defective virus that has no independent existence. It requires HBV for replication. It can infect individuals simultaneously with HBV, right? And can also superinfect those who already are chronic carriers of hepatitis B. Simultaneous infections are also possible, in which case there can be acute liver failure or there can be complications associated with the same. The simultaneous infections give rise to acute hepatitis, which is often severe but is limited by recovery from HBV infection. And chronic infection with HBV and HDV can also occur, and this frequently causes a rapidly progressive chronic hepatitis and eventually cirrhosis of liver. HDV has worldwide distribution. It is endemic in some parts of Mediterranean basin, Africa, and South America, where transmission is through person-to-person close contact. Consider this very, very important. Occasionally, there can be vertical transmission from mother to fetus. So vertical transmission occurs from mothers who also carry HBV. And in case of non-endemic areas, transmission is mainly a consequence of parental drug misuse. So close to person-to-person close contact, parental misuse, vertical transmission are some of the modes of transmission. In HBV contains a single antigen to which infected individuals make an antibody anti-HDV, as you can see in this illustration. A diagnosis depends on detecting this anti-HDV. This antibody generally disappears within 2 months and persists in few patients. Some additional information related to this. So RNA defective virus that has no independent existence is hepatitis D. Well done. I think most of you have chosen. Yeah. Option D. Well done. I need not stop. It was an emergency call. I was with my mother till now. I just came home. So we can continue. Thank you guys. So let's move on to the next question. The site of occurrence of rosacea. I think I need not really discuss this question because all the female aspirants especially are really concerned about this. As far as my knowledge is concerned, I might be wrong though. So site of occurrence of rosacea is limbs, face, fingers, foot. So which anatomical part do you think is more appropriate answer, even though the answer is very obvious, especially to all the wonderful women out there. So which one do you think is a more appropriate answer? Right. So let me review some information regarding rosacea in the meantime. So rosacea is a persistent facial eruption of unknown cause. Even though some antibiotics could be of some use, I've seen women undergoing laser therapy, right? So there are several treatment options which are available. So try answering in the meantime. So as you can see, clinical picture of rosacea on face. So rosacea is persistent facial eruption of unknown cause, largely occurring in middle age. It is characterized by erythema, telangiectasia, papules, and pustules. These papules and pustules can be treated by tetracyclines especially. So a bulbous appearance to nose known as Rhinophyma, 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 may be seen as part of disease and is caused by sebaceous gland hypertrophy on nose. The papulopustular element of disease usually responds well to tetracyclines, but erythema and telangiectasia do not. These may require laser therapy. So, as I think most of you have chosen, option B is the right answer. I said the answer, Ankur, because the answer is very obvious. I know most of you, or almost every one of you, know the answer to this. Okay, very good. Now let's see one of the important topics, standard questions, top questions, which we can expect in myocardial infarction. The first enzyme to rise, CK, LDH, SGOT, amylase. So which one do you think is more appropriate answer? Usually, after an attack of MI, myocardial infarction, so there will be elevation of these enzymes. The plasma concentration of enzymes and proteins normally concentrated within cardiac cells, they are increased in case of myocardial infarction. The most useful markers are, all of them are useful, of which there are some specific most useful markers, which you can see in this particular graph. So time course of various serum markers in case of myocardial infarction, can clearly see among the enzymes, you have creatine kinase elevating, the levels being elevated first. Proteins, you can see myoglobin, right? Enzymes, you can see clear cut creatine kinase. So the most useful markers are creatine kinase and creatine kinase MB, both are isomers. And also cardiac troponins T and I have an important role. Creatine kinase starts to rise at 4 to 6 hours, peaks at 12 hours, and falls to normal within 2 to 3 days or 48 to 72 hours. Troponins T and I are released within 4 to 6 hours and remain elevated for up to 2 weeks. Whereas SGOT elevation occurs at 12 hours around, and LDH elevation occurs 24 hours after infarction. Right? So consider these values very, very important. And for convenience of remembering, you can visualize this particular table or chart where you can see on X and Y axis, you have hours from onset after an attack of MI, and then you have upper limit of normal. So there are levels comparatively in plasma. So you can visualize this, and you can use this visualization technique to answer this particular equation, if at all there are questions along these lines. In MI, the first enzyme to rise is option A, as most of you rightly mentioned. Okay, fantastic. Now, let's move on to the final aspect of this presentation, case-based question. So, Anku's mother, you know Anku, Tenku. So, Anku has mother, Anku's mother, whom we call with so much love and affection as Auntie. So, Anku's mother, Auntie, weighing around 50 kgs, giving this just for sake of case discussion, is suffering from severe migraine from past 2 weeks. It could be because of Anku and Tenku's stress being transferred to her, who knows. So unable to tolerate the pain, she took the available strip of 15 paracetamol tablets at once. Auntie seems to be very crazy. She reported to hospital 10 hours after ingestion of tablets with symptoms of sweating, trembling, and irritability. So the medical personnel in emergency health department would choose which are the following options. Option A, keep auntie under observation till paracetamol leaves the body. Option B, administration of N-acetylcysteine. Option C, activated charcoal administration. Option D, no intervention needed. I know some of you might be answering this right. Very good, even without going through all the options. But please remember, even if you're confident about the answer, even though you feel like this is the obvious option, when we create questions, we try to create traps, soup traps. So make sure that you're ruling out those soup traps. So go through the entire question, all the options at least twice, even though you find a particular option as the obvious answer. I hope you got my point, right? So well done. I know you're answering it right. So take some time, try to find out, because less than 8 hours, more than 10 hours, we have some criteria. See if you can review some relevant information and consider this very, very important. Okay? We will discuss this in tomorrow's quick revision class. I hope you found this session useful, and your feedback is always welcome. Okay, guys, so let's conclude this discussion. And I'm not sure if you're making notes, but that's completely up to you, whether you're making notes or not. Do whatever you feel like doing, as long as you're feeling pumped up or as long as you're enhancing your confidence. As I mentioned prior, confidence building measures have to be undertaken, especially in these final days. Always keep that in mind. If a particular task is not enhancing your confidence, then ditch that task and move on, because when you're preparing it shouldn't be monotonous. It should not be in one specific pattern only. It can be watching videos, practicing MCQs, discussions, whatnot. We have different means and methods possible. Try exploring any of them and make sure that you're enhancing your confidence at the end of the day. Okay? So these sessions are conducted with one such as a major objective. I hope the objectives are being fulfilled, and you need any further assistance, any guidance, subject, academic, genre, you can always get back through mail at howtobedentist@gmail.com. Right? In fact, I've seen your comments. You asked about, yes, mother is not actually doing fine, but we're just hoping for the best. Her hemoglobin's again dropped to around 4, and they're talking about blood transfusions, but as an emergency, because her kidneys are failing, erythropoietin is being supplemented for the past 2 months, and right now we had to increase the dose. Today I consulted our nephrologist, and we're just hoping for the best. So she is in a very sensitive phase now. Another 2 weeks of observation, and maybe we'll have to go for dialysis or transplant in near future. We're just hoping for the best. Let's see. Anyways, challenges are quite common. We all have our own set of challenges. So it doesn't matter what the challenge is. As I mentioned previously, let's see things as they are. Because if I'm worried now, if I don't do what I have to do, just because I have some problem or challenge, then I think that's a feature of a quitter. So if you love someone, do what you have to do for their sake, and I think it's all about seeing things as they are. Challenges are inevitable. We should see things, we should learn to see things as they are. Just because someone is feeling bad, if we sit and cry, I don't think that's going to solve our problems. Actionable intelligence is very important, and what really matters is to see things as they are. And as I mentioned prior, with smile on face and courage in heart, we can face anything and everything in life. So I know you're all having mixed feelings. Exam is approaching. All I would suggest you is the same. See things as they are. Worrying about the exam, worrying about the consequences, not going to do any good to you. On top of it, it's going to derail your preparation, giving you nightmares and all. I know how I can experience that, because in +1 and +2 had that worst experience possible. So I don't just keep this in mind, that if you want to perform at your best, right? So we should ditch those negative aspects and focus on positives. That's the only option which I want you to choose, right? So keep giving your best, and that's it. Love you all. Take care, right? So I'll see you again tomorrow at 8 p.m. I'm not placing updates because by now I think most of you are familiar with the timings. So every day 8 p.m. till the date of exam, as I mentioned, a couple of days prior, we'll have one quick revision class. So tomorrow I'll see you again at 8 p.m. IST. If at all there is any change in the timings, just keep a tab on our updates group. And finally, before I conclude, we're also conducting this practice test 2021, and we're charging only 100 rupees. So you can get back through mail or check out that video on YouTube, right? So once again, wish you all the best. Love you all. Sleep well, eat well. Sleep is very important if you want to give your best, if you want to perform at your optimal capacity. Please don't ignore your sleep. to compensate for preparation. It doesn't work out anytime. Take my word. Chalo, take care. Good night. Thank you so much for all your lovely wishes. Thank you.